We are recording. Oh, good morning. We're gonna watch a short video.
Still coming in.
Oh, it's okay.
Welcome to the Professional and Vocational Licensing Virtual Board Meeting. When the meeting begins momentarily, the chair will take a roll call, explain any specific rules for this particular board, and then move to public comment. The name of the board member will appear on the bottom left-hand corner of your screen. For instance, this is board member Y, and this is board member E. Public testimony will be accepted at the beginning of the meeting and before each agenda item. You can indicate that you are ready to testify by clicking on the Raise Hand button being circled by the mouse on your screen now. At the appropriate time, the board will recognize you to speak and ask you to unmute your mic as shown here. Again, public testimony will be accepted at the beginning of the meeting and before each agenda item. Public attendees will not be able to unmute their microphone until recognized by the board. Public attendees who are recognized to testify will be asked to identify themselves by name and their affiliated organization if applicable. Please mute your microphone when you are finished speaking as a courtesy to others and members of the board. Public attendees will not be able to unmute themselves after the testimony is completed unless recognized again after raising their hand. At some point during the meeting, the board may choose to move into executive session. When the board moves into executive session, the board members' microphones and video feeds will be turned off, and a similar screen as you see now will be displayed. When the board returns from executive session, their microphones will be turned on as well as their video cameras. Welcome again to the Professional and Vocational Licensing Virtual Board Meeting. At this time, the chair will call the meeting to order and take a roll call, as well as explain any additional rules that may be specific to this board.
Internet access. To view the meeting and provide live oral testimony, please use the link at the top of the agenda. You will be asked to enter your name. The board requests that you enter your full name, but you may use a pseudonym or other identifier if you wish to remain anonymous. You will also be asked for an email address. You will fill it in this field with any entry in an email format. Your microphone will be automatically muted. When the chairperson asks for public testimony, you may click the raise hand button found on your Zoom screen to indicate that you wish to testify about that agenda item. The chairperson will individually enable each testifier to unmute their microphone. When recognized by the chairperson, please unmute your microphone before speaking and mute your microphone after you finish speaking. Phone access. If you cannot get internet access, you may get audio-only access by calling the phone number listed at the top of the agenda. Upon dialing the number, you will be prompted to enter the meeting ID, which is also listed at the top of the agenda. After entering the meeting ID, you will be asked to either enter your panelist number or wait to be admitted into the meeting. You will not have a panelist number, so please wait until you are admitted into the meeting. When the chairperson asks for testimony, you may indicate you want to testify by entering star and then 9 on your phone's keypad. After entering star and then 9, a voice prompt will let you know that the host of the meeting has been notified. When recognized by the chairperson, you may unmute yourself by pressing star and then 6 on your phone. A voice prompt will let you know that you are unmuted. Once you are finished speaking, please enter star and then 6 again to mute yourself. For both internet and phone access, when testifying, you will be asked to identify yourself and the organization, if any, that you represent. Each testifier will be limited to 5 minutes of testimony per agenda item. If connection to the meeting is lost for more than 30 minutes, the meeting will be continued on a specific date and time. This information can be found on the board's website. Instructions to attend the State of Hawaii virtual board meetings may also be found online on the board's website.
Okay. Call us, oh, actually I should take roll, right, first?
We do a roll call.
Okay, so, Mark Brown,
Here,
Catalina, oh, so remote, in a room
remote,
by
in a
yourself.
room by myself.
Catalina Cross,
Here in room by myself.
Alan Shea,
Here by myself.
okay, and then Sherry Tokomaru, and then Brandon Rabang is excused. So that's everybody, right? So we have quorum. I'll call this meeting to order at 9:08. First on the agenda would be report from Hawaii Pharmacists Association. Corey?
Good morning. Some HPHA updates I have. We are obviously in the full swing of legislative session. One of our standing events that we have at the beginning of session each year is our policy on tap. So that has two locations, in person on Oahu and also at the School of Pharmacy in Hilo for those that want to attend. Other attendees that aren't able to be there in person or on other islands can attend virtually. That is next Thursday, November 5th. From 5:30 to 7.
November 5th, you February.
I mean, February 5th. Thank you.
February 5th, what time?
5:30 to 7:30. And it's a free event. So members, non-members, everyone is welcome to attend. This is really just to get all the pharmacists up to speed with what's happening with our legislative updates for the session. I'll be going over everything from navigating the Capitol website to submitting testimony to really diving deep into our bills. So everything you really need to know. Our annual meeting is on April 18th, 2026. It'll be at the Oahu Country Club again. Something exciting that we've got going on this year, we have a really great working relationship with the American Pharmacists Association. The president, Michael Hogue, is going to be coming out to attend our meeting, and he'll be giving a bit of an update from APHA as well. He'll also be visiting the School of Pharmacy while he's here. So just a big Hawaii update for Michael Hogue from APHA. And then the last update I have, I don't think we'll touch this because it's not in a bill this session, but just to make sure that everyone's on the same page. I know it was brought up at the last meeting. We were asked if HPHA was going to be introducing a bill about technicians to modify some of the working logistics that you all have faced with implementation for that. Because it was somewhat of a last minute request with session coming up, and we still have 2 years to make those modifications. I spoke with Christopher. I'm happy to work with you guys. If you want HPHA to take the lead on that, which it sounds like you do, I want to also give my Government Affairs Committee the due diligence to be able to plan that out, talk with our stakeholders that are the big hospital logistics and coordinators too, make sure I've got all of them on the same page. So let's just plan to work for that for the next legislative session. We'll still be able to get it done by the next 2-year registration. And then we can go over any other modifications that you all want to Chapter 461 and work together in partnership instead of rushing that together in the last minute. I figured would make a difference. We've got a whole year to build it out, and let's make it organized and coordinated per session. So that's all I've got. We've got a couple bills, but I'll table that because I know we're going to dive deeper into that as the meeting goes on. So thanks for having me.
Any questions for Corey? Nope. Okay, so next thing is approval of minutes. See, so I have last meeting's minutes. I have executive session minutes. Do I have a motion to approve or make changes to any of them?
So Elena, on the November 21st, well, actually, I guess it was the 20th, I was excused that meeting and it doesn't have a note of that on there.
Oh, so
Okay, I can make a note.
Okay, thanks, Christopher.
any other changes?
Ms. Mark, I move to approve.
Thanks, Mark. Can I get a second?
Second.
Owen. All in favor, aye?
Aye.
Aye.
Anyone opposed? Okay. So approve the minutes. Review of advisory committee member candidates. Did the board get to review the list of the RICO list? Yes.
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 Can I get a motion to approve or?
Can I just ask a question real quick on that? Is that, these are the only members that will be on the list, or these are just renewals? 'Cause I didn't,
I believe that these are,
so a 2-year term, right?
yeah. So I think they might be reappointments and maybe additions, but not necessarily the entire team.
Okay. That's the only question I had.
Okay, motion to approve the list.
I so move to approve.
Sure, a second.
All in favor, aye?
Aye.
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 You opposed? Okay. All right, so that list is approved. Okay, so update from Christopher on pharmacy technician registration and the vaccine portion of that pharmacy technician.
Okay, so just want to thank everyone for going through the motions with us. I know it was at times shaky. I do want to report that it looks like we are on just standard application, receipt, and processing at this point. There are a little list of outliers that we are addressing. I got an additional executive officer help to help me with those more technical pieces. It's just kind of hard for me to split my duties, like for preparing a meeting and then, handling that. So, and then legislative session. So I appreciate that additional help to get those taken care of. We are utilizing the delegations that were approved by the board last meeting. So that should reduce the number of applications coming to the meeting. And I think lastly, there's any questions right now, I can take them in. If there's follow-ups for applications, I would prefer that the emails come in and we can handle them by email or phone call instead of in the meeting. But if there's any other questions about anything about the registration and vaccine authorization.
Hey, Christopher, this is Mark. I had a question on the certificate itself. I think on the bottom it says it's not valid unless signed by you. I haven't seen any signatures.
Okay, so they're not, okay. Usually it's a electronic signature that the clerk's authorized to use. So I can run that by our administrators. If there's any need for an update or discussion about that, I'll let you know before the next meeting.
Okay. And do you have any stats of how many applications there were?
Ooh. Generally speaking, I think there was somewhere in the 2,000 range.
Okay.
So I think barring those like outlier issues with there at least one bulk submission, they were all able to be handled before even the 31st. I think we were down to I think I was approving maybe like a handful at that point. Because they had all been able to be processed without any disciplinary actions or anything like that. So yeah, they went through, but I think it was somewhere in the 2,000 range. Yeah.
Really, I guess I didn't have a chair announcements, but I have questions about the renewals, like the pharmacy and the pharmacists. Any problems? I mean, I know we talked about some problems. I think for the room, just to make sure if there was a process change for pharmacy renewals that we can talk about. Because I think the pharmacist ones, we never really have a problem. And then you're gonna generate the list of CE to audit CE, right?
Yeah, that's going to be in February.
Okay, and then, but in terms of pharmacy renewals, did something change?
No, I don't think so. Maybe office statuses as far as staffing, but other than that, processes were the same. So
Okay.
application, so because a license there's a vested interest in a license, then the approvals happen regardless of the discipline. It's just you're referred to RICO. So it's a matter of going through the applications.
So that's a manual though, right? Like
It's
if they,
manual, yeah.
Okay.
So someone has to send them to you.
yeah, 2 years to figure it out again.
Yes, well.
But,
yeah.
yeah, I guess it just seemed like I never heard of any like renewals not occurring. And then this year we had, it didn't occur and people forgetting out. So that was just kind of my question, like if there was a process change, but if there's no process change, then I guess I'm okay. Any questions from you guys there?
No.
Anything on licensing?
No.
It looks like there is no public testimony at this time, Chair.
Thank you. Okay, so if we're done with questions, technician stuff, no? You guys okay? Okay, let's go to ledge session. HB 223. So Chris listed anything and everything based on, he put the search word of pharmacy, I think. And so it's a long list, but I think we should be able to move through it quickly. So correct me if I'm wrong. So HB 223 relating to pharmacy, school special fund, it looks like it was carried over, and as of today, there's nothing that it didn't get referred. So that means it's dead.
It's correct, Sherry, right?
It would pick up where it left off last session, but we have two new Center for Pharmacy bills, so I don't anticipate that one moving. We redistributed
Okay, so
in the House and Senate.
Sherry, that's right, right? If it got carried over and not referred to a committee by now, then we're done. I'm sorry, can you?
Does that
It was carried over from last session and there's no referral yet. So essentially done,
Still alive.
still live.
If it doesn't have a referral.
No
Yeah,
referral.
if it's would still need to do that after carryover, or no?
Also, it's still live, all of these. So we have to talk about it. Threw them all in the pile here. All right, so then let's talk about it then. HB 223. Establishes San Pinoy College of Pharmacy Special Fund.
Do you want me to give you the bill numbers for the moving vehicles this year?
But if the other ones are not,
See them on there.
HB 223. I don't think board's gonna say anything about HB 223, right? Comments?
I mean, there is a section that affects 461 that creates fees.
This is the third introduction of this bill. Let me know if you want me to go.
Go ahead, you can.
This mimics the same process that nursing and medicine currently use, with a special fund that flows through the DCCA to the respective university. The biggest decision, I think, for the board to make, we always come up with the thought of oversight, if that's something that you want put into the bill, or if that's something that we can defer to the Constitution and bylaws. There's just different ways to do it. I'm happy to listen to whatever preferences you guys have. The main thoughts for this bill, the first thing I think we need is accurate workforce data. Nursing and medicine have such good workforce data because of their respective centers that allows them to be really progressive. It would allow us to have a voice for some of these bigger state initiatives. Like right now, there's not a pharmacist sitting on the board for the Rural Health Transformation Program, that big federal initiative of $180 million that'll be rolling out over the next couple of years. So I think we need pharmacy presence there. And it just supports one full-time equivalent that would advocate for the profession from the center and help coordinate more progressive initiatives that can eventually roll out to the whole state. So that's the thought behind the bill. I've got the pricing increases for each of the entities. If you guys want it, I'm happy to talk about oversight if we want that in the bill. But the moving vehicles this session are House Bill 2161. Well, hopefully they're being introduced 2161 and then Senate Bill 2857.
So sorry, what is the question? Are you looking for, so for 2, 2, 3, should I push this to the side and we talk about the correct bill numbers or?
So Chair, I have from last February's meeting. That the board historically supports the intent, but requests an oversight committee.
Your hands.
I think the other thing that Corey had requested from the board was information about what type of personnel should be on the committee. That was in the conversation last year.
You want to talk about the fees? Because
Sure. All right, proposed increases for pharmacists, $50 a year, pharmacies, 100, wholesalers 100, miscellaneous 100. And even with those increases, we're still one of the least expensive states to practice pharmacy across the board.
What about tax?
Nothing for tax.
Checking. And so you're saying a year, so then there will be 100 and 200, okay. Um. Is that real, like, or is this gonna be a surprise with text? Like, how does that work? Sherry, for if they put a dollar amount in there, that's okay.
They can put any of it.
Cause you know how like the tech thing came back and it was like, you know, more than we thought.
There's no RICO involvement.
No RICO, oh, right, 'cause we already have a RICO fee already, right, for the
Yeah.
pharmacist and everybody else?
So this is, and to be clear too, we are mimicking the flow of funds because it already is established for medicine and nursing and it's really successful for both of those entities. I know there was question previously about why it has to go to the university specifically. We're looking at some of these bigger state grants because the university already has the infrastructure to support that and support the benefits. It's much more advantageous than going through the state association or going through the DCCA because they have that infrastructure set up. So to get ahead of that as well.
Does it need to, do we need to check with the school or you guys have already, school's good with it and everyone's good with it?
The school's on board.
We had one more question, fees?
Oversight,
Oversight,
yeah.
committee.
My preference would be to do this through the Constitution and bylaws. If we put it into statute, there's a potential that it becomes like a governor appointed board. Which I think we could do ourselves through having involvement from the Board of Pharmacy on an oversight committee. Those are my personal preferences, but happy to entertain other thoughts.
Is there thoughts on that?
No,
There is no public testimony at this time, Chair.
Do we need to do anything for this? Check? Or do we need to testify?
I mean, because it's affecting 461 by including a workforce assessment fee, then I would recommend still commenting on it.
Maybe the easiest would be to mirror what you did before.
Okay. Yeah, we can take the testimony from last year. And so it'd be supporting the intent.
I think that could be the case for many of these, right?
Probably.
Last year, the testimony was supporting the intent with the thought of having oversight, so I would love to have that conversation now. If that's something that we can align on prior going into hearings, what do we want that oversight to look like? Or what
Oh, to be more specific
what
on
does the board
testimony.
want that oversight to look like? Because to Christopher's point, I know that because it goes through 461 L1, some comment from them.
What is the nursing Center of Excellence Oversight Committee?
Nursing is governor appointed, medicine is constitution and bylaws.
So in medicine, then who are the committee members?
I don't have that in front of me, but I do know that it's, they have representation from each center of practice, and then they also have members on the board that are not pharmacists. So they have someone from medicine, they have someone from nursing, just to make sure that it's more of a collaborative group as well.
What would be like the standard number of members? I mean, obviously an odd number, but.
I'll look into that for you guys.
I guess, yeah, I mean, if we need to provide some type of stance, I guess, then we would want a diverse mix of representation, I guess. And I guess if you're asking if the board should have a say, I don't know if the board needs to send a member, but or if you want a board member in there, that group or something like that, then that's something, do you think the board should be part of that committee?
I don't think one board member.
Pharmacist or non-pharmacist, or does it
I
matter?
don't think.
What do you guys think?
I like the idea of having one member of our board on the committee.
Would the board be open to further discussion with the association and other stakeholders for the other member types. So what I'm saying is that could your testimony be, say, to support that at least one member of the board be a part of the committee? Other than that, it's open to diverse. Okay.
Yeah, I think it just needs to be a
Does
good.
that work for you?
Yeah, that's fine. Then.
Okay.
I would love to have you guys there for the record.
Okay. All right.
Okay, so that's good.
Are you guys gonna take a vote on all your positions at the very end, or do you want to do it one by one?
No, I think if we're talking like this, we're all good, no one's saying anything, and then we do at the end and we say that as discussed.
Okay.
You know, is that okay?
Yes.
You guys okay with that?
Yes.
Okay, just be clear before we move on from one bill to the other.
Okay, all right, we'll do that then.
So Sherry mentioned the other two bills, the House Bill 2161 and Senate Bill 2857. How are they
Yeah.
different than the one from last year?
No different.
No different at all? Okay.
We modified the intro a little bit to be a better explanation of what the intent of the initiative, but no big difference to the structure of the
Okay.
bill.
Okay.
So you guys want to mark for 2161 and 2857 the same
Yep.
positions? Okay.
But they weren't on the list, is that okay? They're not on our list of bills, I don't believe.
I didn't see them.
I don't have those numbers down. Is it okay to comment on them? Gary?
But we can state in testimony for those bills that we can support testimony referring to the previous bill.
Oh, this one.
Yes, so we can say
230.
that the board met and heard on HB 223, which is substantially similar to this other
Okay.
bills, and that they support the intent with these information.
Okay.
And then at February, then we can actually vote on those bills.
Okay, they were just like formalized last night. I think they cut off, so it's not critical. It was before they done.
You got a way out around it.
All right, HB 561 relating to pharmacists authorizes a registered pharmacist under contract with the covered entity for purposes of federal 340B drug pricing program to supervise via telehealth the filling and or receipt of a prescription in certain circumstances. This looks like it was carried over from last year, has not been referred. I think we was with our testimony from last year.
Yeah, substantial testimony from last year.
HB 1643 relating to pharmacy, specifies a framework for the administration of audits of records of pharmacists and pharmacies. Is that yours?
Yeah.
Okay, you can go ahead.
So just as a general note, our biggest pushes this year, aside from the Center for Pharmacy, are gonna be to help protect independent pharmacies and unaffiliated pharmacies in particular. So we've got two bills that are doing it. This is the first one. When I was speaking with a lot of the independent owners in our network between sessions, I'm just hearing horror stories of the auditing process. They get no heads up. For auditors coming in, auditors will ask for additional scripts until they find something that they can be dinged on. It's to be pretty transparent, seems pretty predatory. So we copied Tennessee's audit provisions. There's a lot of notable things in the bill. It's a couple pages long if you guys dig through it. The biggest ones, we've got 2 weeks written notice prior to an initial audit. The period of an audit will not exceed 2 years back, so you can't go more than 2 years back from an active claim. No audit scheduled in the first 7 days of the calendar month because that's when the highest volume for our pharmacies are. There's auditing report deadlines. It basically just gives a framework for independent pharmacies to have what seems like a common sense auditing practice, but I know that what's in contracts isn't always followed, so it'll outline it in statute.
Comments from the board?
Yeah, Elena, real quick, this is Catalina. So, can the members, who are attending, the attendees comment on these as well as we're going through them? Or is it just for the board
yeah.
members to comment?
No, if anyone wants to raise their
It's
hand.
open? Okay,
It's
so.
fine, yeah, it's
okay,
open. Yep.
Thanks. Okay. I don't have any comments on this one.
Mark, you had something?
Yeah, I didn't see what the penalty towards the PBMs or the insurance companies were if they don't do this.
That's a great point. Our other bill is gonna establish some kind of
Okay.
oversight entity within the insurance commissioner's office.
Okay.
We'll be imposing penalties. That's a great thought, and we can certainly add penalties as it goes through session. I mean, I know other states have anywhere from like $10,000 to $40,000 or some pretty significant penalties. So, Mark, if you want to propose a financial number.
$100,000, no.
Every time they, you know, violate one of these, then you'll be able to hire about 10 people,
I know.
you know, to be working in the insurance commission. I don't know, in terms of the board though, what we can really. I think my personal, I guess personally, audits are very burdensome. So in terms of safety, now we cross into safety because they're taking time away from dispensing. So now the board is now talking about safety, because you're increasing workload. And not to say it's a waste of time, but it is a lot of repetitive things that they're just looking for to see that someone made a billing error, right? It's not like they're not even looking for
Not an outcome error.
right. It's not outcomes, you gave them the wrong drug. We're just looking at the day supply was wrong, or you gave them an extra gram of cream or something. Where it now takes away from filling prescriptions correctly. So now the board has to, you know, can say something about, because normally we don't say anything about financial and reimbursement and PBMs, but if it does affect safety, I think that's where the board, you know, we can say. You know, this bill is something we support because of the safety piece. I don't know. Alan? You think, or, I mean, I think that's where I'm at. I don't know.
And the notice part's good, that it's not gonna be on certain days of the month and, you know, all those things. That's part of the safety part.
Yeah, I think there's some good provisions for safety in here. That's probably definitely where it lies for us.
So I think our response needs to be that for workload pharmacists, and we need to kind of focus on that section for the support. And saying that we support this bill because of the burden, the work burden. And you know, the number of hours it takes to do an audit and just how many audits that we're getting. I didn't read it really well, but does it say how many audits they're allowed to have? Because for me personally, we get a certain company sends one a week. 1 week we get.
Yeah.
I mean, so we just,
So,
yeah, so
Is there like I say, a best practice standard for a sort of, I don't know if this is in the bill, sorry, like a sort of duration between and everything. So like a standard schedule that would be the pharmacy board could point towards as being adequate.
Dependent on the claims. They're so.
yeah, and so some
Okay.
of them look at dollar threshold and they automatically get an audit. And then, but the flip side is some companies like to send one time a year, and then you end up with, you know, pile of papers that you need to submit to them, right? So that's even worse. I don't know, because those are hard versus frequency, but I don't think this bill addresses how often or how many they're allowed to audit. And I don't know if
There's space between.
yeah, I don't know if you didn't touch it, right? That piece. I don't know if we
I don't
can.
know if I've seen that before. I don't hate the idea, but I don't know if I've seen that.
Okay. Just
That
want
was
to
my
be clear
question.
if there was some kind of alternative suggestion by the board.
No, just, I think, support the intent, so you got it over, support intent and labor, any other pieces that the board can chime in on for support of 1643?
Sorry, was it support or support the intent?
Support, right? Do we
Yeah.
support the bill or the intent?
Probably the intent, I mean, because it's probably gonna change a little bit going through ledge.
Yeah, that's another question. So if we say support, like without the intent, does that mean we can't change?
Well, I mean, you're raising concerns, so I think if those concerns disappear, then it could be support, yeah. Or if they amend to like at least some security, then you could change to support. Yeah, I think that's within your purview.
Okay. So you know what you're writing down? You got it?
I got support the intent, but the safety concern is workloads on pharmacies and pharmacists with regard to the numerous.
Numerous, or the length of time it takes to respond to these audits,
Okay.
taking away from state refilling prescriptions or something like that.
Okay.
We good?
Good.
Okay, Okay, SB 324 relating to pharmacist mandates reimbursement for services provided by participating registered pharmacists practicing within their scope of practice by private and public health plans beginning January 1, 2026.
A version of this passed last year. This will be,
Yeah, okay.
she won't be.
Yeah, because I thought this passed. Okay, all right, so we'll just kind of track it. SB 1279 HD1 relating to pharmacists authorizes a registered pharmacist under contract with a covered entity for purposes of the federal 340B drug pricing program to supervise the filling or receipt of a prescription via telehealth in certain circumstances. This is carried over from last year. Are the same as HB 561 testimony, Chris? Yeah. Okay. SB 1579 relating to pharmacist mandates reimbursement for services provided by participating registered pharmacists practicing within their scope of practice by private and public health plans in the state after 7/1/26.
Same thing, version of this passed last session.
Yeah, okay. SB 2047 relating to PBMs establishes requirements for PBMs that reimburse contracting pharmacies for drugs on a maximum allowable cost basis, including maximum allowable cost lists and maximum allowable cost reports and complaints processes. Corey, is this yours?
No, this is Kyogo, like I don't know if this is something, but.
So let's look at 2047. I was very confused when I read this. So I wasn't sure how, like, does this bill, help me, does this bill mean that they're gonna hire somebody, like allocate funds to hire somebody, or is this just a bill like to say somebody needs to do this?
I think it's just that the PBMs have to reimburse them that cost.
But there was enforcement, right? There was something about creating a list. State list of maximum allowable, so someone has to do that, and then it had something about. Insurance commissioner, he says a fine of up to $10,000 for each violation by PBM. I mean, so that means someone has to actually like report it and someone has to investigate it and all of that stuff. That sounds like work that.
I think if it's going to affect another divisions,
then you guys should just track. I don't think you should comment on what they should or should not do in the transcription with regard to staffing or anything.
Yeah, no, so I was like, well, this one, I don't think the board has anything because it's not about safety. It's about, we always stay away from commenting on reimbursement. We can just track.
Yeah, I agree with that. So I'm Derek. I'm the owner of 5 Minute Pharmacy, a local independent pharmacy. We have about 100 full-time employees, about 20 full-time pharmacists. I agree that, I mean, this supports and it's good to have transparency for PBMs due to shrinking reimbursements. But as far as I believe what the board is concerned, it's strictly to do with the reimbursements.
Yeah. So as far as for board, we just kind of just track that one.
Yeah, okay.
It's 431 is insurance, is that what that section of the law is?
Yes.
Okay.
It looks like it was referred to HHS and sleeping, so it's scheduled, whatever. Just have it.
It says like trickle down, so whatever happens with this insurance. It's not doing that.
address, but I mean, it kind of starts with that.
So SB 2208 relating to PBMs. Requires DHS to establish, select, and contract with a third-party administrator to serve as a state pharmacy benefit manager who shall be responsible for administering all pharmacy benefits for Medicaid beneficiaries enrolled with Medicaid managed care organizations requires Medicaid managed care organizations to contract and utilize the state PBM, establishes requirements to procure the state PBM in addition to the requirements under state law governing purchases of health and human services, establishes requirements and prohibitions for the contract to be used by the DHS when contracting with the state PBM, requires the DHS to establish a single preferred drug list to be used by the state PBM, requires the DHS to consult with the MedQuest Healthcare Advisory Committee on the development, implementation, and oversight of the state PBM program, requires reports to the legislator and appropriates funds. Comments?
I can comment on this.
Okay, is this
like,
yours?
No, it's not.
Oh,
mine.
okay.
I love it though.
Uh,
This is gonna be a MedQuest single source PBM. So right now, instead of having 5 different formularies for the 5 different insurance organizations that service our MedQuest patients, it would create a single source PBM. The states that have done this have literally saved hundreds of millions of taxpayer dollars by having a single source formulary. Physicians love it. Very user friendly. It forces price transparency for having just one formulary. I do know it's a very heavy lift for the MedQuest division, and I'm not sure if they're ready for it at this moment, especially with the cuts coming down from the federal government. Yes, I love the intent of the bill, but I'll be curious to see what MedQuest's lift on it is.
I agree with those comments. And with the state RFP coming up over the summer, I think this is going to be and similar to the last, I think that's the primary price.
Do you mind just every time you speak, is it okay to just let us know who you are again for the record?
Yeah, I'm so sorry, Derek, Tengu on the owner of 5 Minute Pharmacy.
Thank you.
Yeah, thanks, Chris.
Is chair okay with him just staying?
Yeah. It's good.
Yeah, okay, good.
Honestly, I just don't see this like, I don't know. It just seems like a lot to ask, I don't know if they're gonna ever get to get it, because I mean, working with Medicaid, nothing changes very quickly. So to ask them, to see a bill, I don't see this actually working, but support the intent. I don't even know if the board needs to say anything about this, because again, it's reimbursement. We might want to track it and not comment on it. What do you guys
Yeah.
think? Just track?
Track, yeah.
Because it's not really us. Okay. Okay, so SB 2038, Christopher, do you want to talk about SB 2038? Yeah, authorizes certain persons to receive abortion medication with a label that does not bear their name and any other identifying information. So it requires that the label does not have the pharmacy address, the pharmacy phone number, the patient name, the prescriber name. The strength of the drug got changed, or the drug name got changed to something else.
Just generic like abortion
Medication or something. Yeah,
The serial numbers is like
medication, abortion care is instead of the drug name. And so it's being heard tomorrow at 3:00.
Correct.
The board needed to submit a stance before the meeting because it gets through administrative review before the board can send something. So we talked and we said the board will discuss it today, which we are going to do now, and that we support the intent, but had administrative issues is I think what we sent in, right?
Yeah, just I think it was specific to say safety concerns and
Is it administrative? Like, because I mean, I don't know how, like, for example, Walgreens would take the W off of their label.
correct,
you
yeah,
know?
so it's those kinds of concerns, like if it was like
Logistic concerns. So I think that's what we submitted as our testimony because we had to turn it in before the meeting. But we did say we were discussing it during our meeting. So let's discuss it during our meeting and then we can always amend our testimony or, provide comments tomorrow. What do you guys think? 2038.
But I didn't see that it's modifying like 328 or anything with the labeling portion of 328.
You know,
It took off. I saw it somewhere.
section.
It's in. I saw the take is directed.
This would be in 453, actually. So this is actually in the medical chapter. So that's what's interesting is that it seems like most of the bill's force is housed in 453 and 457, I think it is. And those are practice chapters. So although they refer to 328. So in 328, the abortion care medication is added to that list, right? It includes opioid antagonists
Yeah.
that fall under this like exemption. But the contents of it looks like it's in like 453 and 457. Those information. So really like, I know that part of it is where the pharmacy board's kind of caught where that's the medical boards, you know, like Juliana and Purview. So, it's kind of touchy, I guess you could say.
Oh, yeah, so 328.16 amends section A and C. 1A and C. Talks about the label mark. I just see safety concerns when we take a patient's name off of the bottle. So for me, working in retail pharmacy, we verify a patient's name and date of birth, and if we take off all identifying information, what if this gets to the wrong person? And so I understand why they don't want that information on the bottle. Like if it gets out and someone's trash and someone's dumpster diving and sees the bottle and sees that they got it from Dr. Jones at this address, or Walgreens filled it and they can start protesting at Walgreens. But if we take the patient's name off the bottle and we just don't have a way of verifying that the right person gets the right medication. So that's my safety concern. And then logistically, taking the logo of the pharmacy off or making sure that, you know, all of that, I just don't even know how, I don't even know if Walgreens has a W, but Walgreens would take the W off their label, you know, or to de-identify the pharmacy at that point. I'm thinking my software and it has our address and our phone number. I wouldn't even know how to take that off the bottle label for that patient. So that's the technical side of things. Like I wouldn't know how to do that. And, you know, to do it for like one patient on a certain day who probably needs it right away. I see that as a burden for like the pharmacies out there. So that's kind of where my head goes.
They're legitimate, yeah.
Yeah, so safety, number one, I don't know how you would verify that the right person, if they come in Jane Doe, that's the wrong Jane Doe, and you know, we give out the wrong medicine.
And also in the household, if there's two bottles there and someone takes the husband takes it instead of it doesn't say who's it's for, you know, I mean, another patient could get it and not know what it is.
I mean, you would have to ask for identification prior to even going to search for the medication and find in the first place, because that alone would be confirmation that somebody has obtained that medication. So if that's not the person, then you bring the medication up, then ask for ID, for example, and they walk off.
Like I was really confused, like, are they gonna send it under my name, but they want the label to say, you know, opiate, I don't even know, not opiate receptor, but you know, abortion something or is no name, but it'll come in under my name that we can then verify, or is it gonna come in as Jane Doe and we'll never know? It couldn't really find that in here. It just says labeling, but maybe the script comes in with their name, but then the label needs to say something else. Now software wise, I don't even know how that happens,
I
right?
think the former, yes.
Yeah. So these are the questions and concerns, just safety wise, that if the wrong person gets this is a huge thing, right? Yeah.
This is
Is there
Catalina.
any? Sorry.
Oh, sorry.
I was just gonna
just
ask
going-
real quick if any of the members would be willing to testify specifically on this tomorrow with these concerns.
What time tomorrow?
Free. It can be remote. I can let them know.
I can testify tomorrow,
Okay.
but I need to know what the board says, because, you know, I'm
Yeah,
not
of
gonna,
course.
right, so let's come up with something, consensus on what to testify for, but, those are,
No, so your safety concerns could be alleviated if it is linked to a script. It's just the label that has
mhm,
no
right,
information.
that would help with the safety concern, but then the other side would be a technical part would the lift on the pharmacies to go ahead and get their software to print nothing, to print blank things, that would be the other side would be, you know, to then get feedback from pharmacies, is that possible? Without a label, without a name on it? Or to take off your phone number and take off your pharmacy name needs to be off of it, doctor's name needs to be changed to has some weird, oh, it says business address instead of the address of the business, it has to have zeros for the phone number. Instead of doctor's name, it says the practitioner. And the drug name needs to be medication abortion. Instead of miso, whatever it is, I know I can't do it. You know what I mean? And then, but again, yeah, so those are my. Carolina, you had a comment or question?
I have I guess a question. I'm just curious to know if any other states have implemented a process like this. I haven't had a chance to look into that to see.
Yeah, California just did. It's called a shield law. It's to prevent
California.
pharmacies and healthcare providers from being targeted for dispensing abortion medications. So I do think there'll be a strong argument in favor for it because we are such an abortion friendly state. Like the intent is there.
Well, I'm sure, yeah, I'm sure, there's gonna be people that support this bill, and I understand, the whys, I understand the whys. But on the state board side, put the state board hat on and, you know, in terms of safety, this just seems like it might set up a little bit of a problem.
Yeah. I mean, any medication that's dispensed that's not labeled properly. I mean, 328 has very specific things about what needs to be on a label, and it's a
I mean,
safety.
we don't need, yeah, we don't even let it say take as directed. I mean,
Yeah, I mean,
the state is very specific. You can't even say take as directed. So to then take off the name of the patient, that just seems counterintuitive, you know, like,
yeah, I mean, to me, it's scary. I mean, you'd think a woman that's taking this would go take it right away, but is there someone who might take it home and think about it and have a chance for someone else to take it? You know, it's not a drug that doesn't have side effects and big effects. So it is definitely a safety issue.
so in terms of this testimony for tomorrow, which I guess I should, sure I could do, sure I could do it, but, where's the board gonna? Yeah, I could do it. You guys have comments? Is it?
Yeah.
Derek?
Derek Tendon,
Derek, mhm.
owner of 5 Minute Pharmacy. I agree with you. Logistically, it's gonna be a nightmare. I think I remember in the past, don't quote me on this, but things could be handwritten as a label, but it opens up to a lot of liability.
Yeah, I think we thought about that, like if you can handwrite a label, I guess,
But there's no way in our system to
Computer-wise.
to do these things
okay.
electronically.
Do we have anyone from Longs or Kaiser? Kaiser's here, Stacy. Do you know if your system would be able to handle, and Rob's here from CVS, handle an anonymity of patient?
We cannot. We're struggling with the same thing you just mentioned. Yeah.
How about CVS? Rob?
I think
Yeah,
most of the
Rob.
big chains labels are the chain name is on the script label before it's even put in the machine, I believe.
Rob?
Yeah, Rob with CVS Health, Long Drug. In states that have already passed laws like this, our solution has had to be with using basically scissors on a label. So it's pretty difficult to comply. Share same concerns that others do. I get the intent behind it, but definitely has been logistically challenging for even a large organization such as ours to comply with.
Okay.
Just from like a very weak research, it looks like 1, 2, 3, 4, 5, 6, 7 states have enacted prescription label shield laws.
Hmm.
It looks like California, Massachusetts are maybe the more robust. Which includes the practitioner's name being removed, but I'm not seeing where it says the pharmacy names being removed on these.
So my fear on this side is that then pharmacies aren't going to carry it. So now you just decrease access because if you're going to make it impossible for the pharmacy to fill it, then they just don't carry it. And then now patients now cannot get this pill because nobody wants to carry it because they cannot comply with this law. So now you just decrease the access to patients because no one's going to have it. You know,
So a lot
so
of those 7 states deal with the,
apparently with scissors at CVS, I mean, they just,
I mean, but you know, whether it's scissors or handwritten labels.
I just
don't want to
worry.
decrease access.
Yeah, I just worry that like
I mean, they can.
an average pharmacist is going to be like, that is not something
normal,
I'm
but
willing to do.
It's not
Yeah.
this traditional way, but
Right.
given that they can MacGyver any other number of remedies,
Yeah.
I hope they would continue to carry.
But that would be a concern of mine if this was my bill, is that because it's not a mandate. Because all the pharmacist has to say is, I don't have it. Or I won't fill it, which we allow them to refuse to fill stuff, right? In the state, they can say no. Then more people would say no because we just increase their ask. We're asking them to do more. And so now, is this gonna decrease access to pills? I don't know. So that would be not really a state board issue, but just like, you know, the health of this bill might, I don't know.
It's a practical reality.
So it looks like they have to, in California at least, it looks like they use internal logs to manage all the tracking.
Okay, so board wants to say what?
Everything you just said.
Do you guys agree with that piece? I mean, I guess,
Well, currently the testimony, like you said, was submitted to state, just generally that the board or that the legislative liaison identified just safety concerns and logistical concerns. But that's it. If you attend the meeting tomorrow, then you can explain these in
Okay.
more in detail.
is that, but we need a consensus, like we need to agree on those items, right? The label won't have a name. I don't know if I'm allowed to say that people might not carry it, if that's a board concern really. Um,
Well, access to care, I think, would
Access to-
resonate at the ledge. They are very much concerned about access and not decreasing availability.
yeah,
So if that is a practical reality, they should know about that.
okay, so
Certainly.
the safety concern, labeling, decreased access. Challenge to pharmacies to comply.
Are any of the pharmacies going to be testifying more on this bill?
Is CVS providing testimony, Rob? It's due at 3:00. If you are.
I think historically we have not provided testimony, just a pretty sensitive subject for us to come out on.
Okay.
Yeah, I understand. What about Stacy?
Yeah, initially we were going to, but yesterday our government relations person just recommended that we not, at least this go around, again, just due to the sensitivity. Alana, talking about your previous comment around the safety, I do think that the prescriptions do have to come in with the patient's name, because I don't think 328 was changed in terms of what's required for a valid prescription. So the name is still required. It's just the label that will have to.
Okay, yeah, okay. Well, that's a relief. No. I assume that, but then I'm like, it's not in here.
Yeah.
So what am I missing? Okay, so it would come in with the patient's name and just the label needs to take off the name. That's where the scissors comes in.
Still a huge logistical challenge, though.
Yeah, and it's not that you just eliminate and cut off the top section of the W with the Walgreens. It says it needs to have 00000 for the phone
Well,
number.
that's why I think handwriting a label might be the viable option.
Yeah. I mean,
I'm assuming we're talking about a nominal percentage here of fillings. Like it's not like a significant, it's not like allergy medicines being filled every
no, I
day.
know, but like I know that we dispense a lot of these or not, it's dispensed a lot. Right now, I think physicians' offices are dispensing it because pharmacies, dispense or can, I don't know if it's can, won't. You have to go in REMS, you have to do all this extra stuff to dispense them. So a lot of pharmacies don't dispense them. So the doctor's offices are dispensing them now. There probably are some pharmacies that are dispensing them, but so yeah, I think they are being used a lot instead of surgery.
Okay, I see.
Yeah. So we just don't know because the doctors are doing it.
You were saying that, so as far as the board's chapter 461, when it comes to physicians and their practices, in a sense, they're sort of exempt within their practice if they're filling for their patients, right?
They have their own labeling stuff.
Right, but they're exempt from your chapters obtaining a pharmacy license or a
Yeah,
pharmacist license.
pharmacists could, physicians can dispense without.
Part of their
a
practice.
Yeah.
As long as it's only their patients, right?
Yeah.
So does this bill look to be more catered towards that situation?
There was a lot of language about that, right? Like if the practitioner is not the dispenser or something like that.
But it does, also, I mean, it's not in 453 where it's the issue, it's when it goes into 328, which is where you guys see the effect. Because you guys have seen the effect from opioid antagonists, I'm guessing. That was included recently, in recent years. But that doesn't involve, I think, removing the provider's name.
No, the doctor's name
Driver or the
stays and the
bar.
pharmacy stays on it. It's just the patient name changed to opioid antagonist use.
But this does seem the bill is more catered towards allowing the physicians to provide that to the patients, their own patients.
I mean, they could, right? But then if it does go to the pharmacy, then it holds the pharmacy to that same thing.
Right.
And the way I'm reading this too is it's only if the woman once asked for this to happen.
Yeah.
It's
Yeah.
not every single time.
That's where that number goes down, right? Because I mean,
When someone asks for it to be anonymous, then we have to do this.
yeah. So how many of them are gonna ask? I don't know. Some states probably more than other states, and I don't know. So we can just bring up those things then.
So this is only for the labeling because generally speaking, when we dispense medications, we also give them information, like an information packet about the drug that usually has the patient's name and the drug and everything on it. Are we still dispensing that or is that anonymized also?
That's affected.
But their name will be on it.
Yeah.
But scissors.
Scissors,
Scissors.
Alan,
Not a label.
not a label.
Well, actually, thinking about the
It's an
label, thing,
insert,
you can just
right?
create people could probably just create a generic label to use for every single patient the same way. Because I think I mean, looks like the labeling is going to be the same for every single patient that is going to
Yeah, that's true.
request this. So you could just create like a label that on your Avery labels and use that.
Yeah. Sure.
So support the intent, you offer some concerns, but that's not necessarily jarring the more forward.
We wouldn't say, we're not opposed to the bill. We just had those issues. And again, like Alan just came up with a solution. Yeah, you just print it on that Avery thing and you use these labels for your patients, right? And then you just process the script through your system the normal way, and then you use these generic labels because everybody has the same name, same drug, same doctor. You can use those generic labels and just stick it on your bottle and let it out. So that's a good solution. So, I will show up at 3:00 via Zoom. Okay. Next one. That was a lot. All right. Next one is SB 1509. Requires the Legislative Reference Bureau to conduct a study on best practices for the regulation of PBMs and reduction in prescription drug costs for health insurance plan beneficiaries. This was carried over from last year. I don't see referral yet.
I don't think this will move. Last year, I testified LRB can't do a study like this. They don't have the infrastructure and they wouldn't be able to get contract details. So.
Okay. All right, so we'll just kind of monitor that one. SB 1495, just track it. It's probably not going to. SB 1495 SD1 relating to hearing aids. Exempts from the general excise tax gross receipts received by a hospital, infirmary, medical clinic, healthcare facility, pharmacy, or a practitioner licensed to administer drugs, individual from the sale of hearing aids. Just carried over from last year. You can just track it.
Okay.
HB 205 HD1 related to workman's comp. Establishes the payment rate not to exceed cost plus 40% for non-prescription drugs, over-the-counter drugs, or non-legend drugs for work comp purposes. So there's no ceiling on OTCs, so they're trying to put a ceiling. It's carried over from last year. Just track it. HB 216 relating to prescription drugs establishes requirements for clinical review criteria and clinical practice guidelines is used to establish step therapy protocols, provides a process for a patient to request an exemption to use step therapy protocols, establishes insurance coverage requirements relating to those, the use of those step therapy protocols and standards to appeal an adverse step therapy exemption determination. Carried over from last year. Let's track it. HB 872 HD1 related to health authorizes healthcare practitioners to make undesignated prescriptions of single-use epinephrine for the purpose of stocking a supply at various types of businesses and state and county government offices, including public schools. Oh, EpiPen. Carried over from last year. Let's check it. Yep. HB 903 HD1 relating to student health authorizes a school to maintain a stock of bronchodilators to be administered used under circumstances, under certain conditions, authorizes certain employees of a school and department personnel to administer certain medication in emergency situations. And here's what affects us. Amends prescription drug labeling requirements to include certain information related to a school if applicable. That's where the pharmacy comes in. Carried over from last year, just check for labeling. HB 933 HD1 relating to general excise tax reductions. Looking for pharmacy in here. Oh, here, reduces the general excise tax rate on the gross proceeds from the sale of non-prescription drugs. Carried over from last year, you can track that one. HB 959 relating to taxation. Looking for pharmacy because this is way long.
Sales tax on OTCs.
Another tax on OTCs? All
Yeah.
right, that carried over from last year too. Thanks, Mark. HB 1539, just track it. Yeah, HB 1539 relating to prescription drugs, repeals certain prohibitions on the imposition of fees, conditions, or requirements on community retail pharmacies that are not imposed on mail order pharmacies. This one got referred to HLT and CPC.
Just trying to level the playing field between
Mail order and
retail pharmacies.
so in terms of the board and for Chris,
It would help access locally if there's no required benefit for mail order.
so the financial part of the reimbursement part, we don't have a position, but in terms of the board will always support in-person pharmacists versus mail order, for safety and clinical outcomes, maybe.
And
Yeah.
quicker access, I can walk in and get it rather than wait 3 or 4 days.
So can we, is that Good.
So what is it?
In terms of like the reimbursement part of making sure that that part's not the reason, it levels the playing field so that patients can get in-person pharmacy care. Access to drugs more timely. And,
So are you supporting the intent or are you just tracking or?
we would support the intent of the bill because we want to make sure that patients can get in-person services.
Access, improve the access to medication.
Okay, so the board's not commenting on the reimbursement section, just that.
Yeah. Okay, HB 1611 relating to tax, anyone else have stuff for that bill? Good, okay. HB 1611 relating to taxation. Again, it's OTC drugs. So this one got referred. This is OTCs, not even the prescription drugs, so we can just check, I think. Good?
Yep.
HB 1648 relating to workman's comp. It's the same one as the other one, I think, with OTCs and the price doesn't really affect us. So
Prohibited, over the counters.
yeah, it's the same as
Doesn't allow dispensing of OTCs.
This was a carryover.
yeah.
Or sorry.
No, it's
Sorry, 205 was the carryover and it looks like this is the replacer.
the workman comp one was.
Yeah, so this was, I think this might be the replacement bill
Okay,
from last year. This might, I don't know.
okay. And you just track it because I think it's financial stuff.
Okay.
It's not allowing
So
that to get under workers' comp.
workman's comp, right? That's
Yeah,
it.
that OTCs cannot be billed under workers' comp.
Impressive.
Track too.
Relating to opioid antagonists, beginning 1/1/27 requires health insurers. And HMOs to make it the lowest tier. Or something like that, and improve, provide prescription drug coverage, provide for at least one generic opioid antagonist and device. So that's not us really, so you can just track it, yep.
Okay.
SB 226 relating to prescription drugs establishes requirements for clinical review criteria. Step therapy, I swear we just read that.
Similar, yeah.
Oh, that was carried over from last year, so you can just track that one. SB 480 relating to health prohibits drug manufacturers and wholesale distributors from restricting or denying access for pharmacies contracted with 340B covered entities to purchase 340B drugs at a discounted price under 340B program. This passed last year, right? Or similar bill?
House, I think the House Virgins.
Yeah, so it's probably not gonna do anything, you can track it. SB 531 relating to education. So clarifies labeling requirements for bronchodilator prescriptions issued to the DOE. So this was a carryover from last year. It sounds like they have another one that's going to be the one we just talked about earlier.
Right.
So this one just track it. SB 874 relating to veterinary medicine, requires veterinarians to provide a written prescription upon the request of a client for any animal patient of client with whom the veterinarian has established an existing patient relationship, allows pharmacies licensed in the state to dispense medications prescribed by veterinarians. I thought we could do that already.
I thought so too.
Authorizes the Hawaii Board of Veterinary Medicine to establish penalties, which may include fines or suspensions. Wait, something, this was heard yesterday, right? Because we can fill.
Good folks currently, yes.
It requires veterinarians to provide a written prescription. I don't know.
So does this say anything about us purchasing veterinary only medicine?
This only affects 471.
Okay, so it's not
So-
anything.
Yeah, this is veterinarians, so it provides them authority, but I don't know why it would include that in the title. The subsection that is talking about pharmacies says any pharmacy duly licensed in the state may dispense the medication prescribed by a licensed veterinarian pursuant to this section, provided that all state and federal certification requirements for handling and dispensing veterinary pharmaceuticals are met.
We don't have state specific veterinary, well, other than the labeling.
Okay. Where else would it say who you could or could not prescribe to?
Built for, you mean?
Yeah. Go for, sorry.
It's in their specific sections, right? Like the nursing, there's the physicians.
So for
the-
us though, for filling part,
Yeah, where would there be a restriction on a licensed practitioner, a type? Like a veterinarian, like. Is there like a list of okay people that you can fill, or is it literally just?
I think
Like
it's
your
in their
license.
section saying that they are allowed to do it, you
There's-
know. Ophthalmologists and,
scope of practice, they always have their scope of practice.
naturopaths, all those. Their laws, that there's nothing in our law that says these are the people who can prescribe. Who's given prescriptive authority basically is,
But this is now gonna state like. That you may.
we always could, I mean, it's.
Yeah, I know.
Right, and also, how do we address that?
It's still in their practice chapter. It's not in your 461.
Yeah,
Yeah, they're not touching ours, so they can say,
This wouldn't create any restrictions for pharmacists in their own license and chapter, right?
they're telling them we can do it and we can already do it. Like,
I know, but it also has some conditional language, provided that all state, federal certificate.
yeah,
For handling and dispensing veterinary pharmaceuticals are met, like, why would that go in there?
yeah, I don't know what this
Is there an
duly
issue?
license in the state means. I don't know what that means, so I have,
Is there issues with pharmacies and how they handle veterinary pharmaceuticals?
maybe they don't want the pharmacies to dispense it.
but I think this is requiring them more that they have to provide a prescription. If the
That's-
owner
they
wants,
don't-
or
Yeah,
before they were dispensing it out of their practice only.
Yeah, I think that's the main thing, probably giving them more choice on where they can get their prescription instead
Yeah.
of having to purchase it directly from the veterinarian.
Yeah, I mean, it doesn't say shall, it says may dispense, so it's not really like a command.
But I guess my question would be duly licensed. I don't know what that means. Duly licensed,
It just means that they're licensed in the state.
like it's
Yeah.
a valid license?
Yeah.
Okay. So it's not really,
Do you think it might have anything to do with like for the patient and the reimbursement, like through their, because a lot of people have pet insurance, and then maybe the insurance companies are requiring a prescription?
Could be.
oh, it just says here, it says the consumer prescription choice. So yeah, they're just making it so that the vets don't, you want this prescription that's gonna cure your dog, you need to buy it from me. They need to give
Yeah.
it to and let them go somewhere else. So probably not us, right? We can just track,
Yeah, I think so.
doesn't touch us. Just giving them a choice. Okay, good. Related, SB 875 relating to general excise tax reductions. So it's another OTC, they're trying to get rid of the tax on OTC, so it carried over from last year, we can just track that one. SB 956 relating to prescription drugs allows a patient seen in person by another healthcare provider in the same medical group as the prescribing physician to be prescribed an opiate prescription for a 3-day supply or less via telehealth. It's carried over from last year, so I'm assuming,
Seems to be not really related to pharmacy practice, but
We'll get the. end
Practice,
result.
practice.
Yeah, we'll get the result of whatever happens there. So just track it. SB 1043 HD1 relating to taxation. OTCs, that was a
I think
carry
on the
last year.
last one, we did have a comment last year that how's the pharmacist supposed to know that the patient that's not their primary care? That we would, at what point would we be responsible to know it's only 3 days is the max that we can do? So I think it was just a comment that we made.
Okay, so if it comes up, then we can comment same as last year.
See,
If it,
see if I can. It's not a key.
I looked if it's a carryover, but I don't know.
Oh, it does.
Yeah, right.
So it just,
For 956, right?
yeah, sorry, I'm just, they removed the testimony from last year, so I can't look at it. Sorry, so I can't.
Yeah, I don't know if we even testified to it or if we commented, like, if they
Commented, I
did
think.
come up. Did it get referred and like, yeah, it did, right?
Yeah, I got referred to Health and Human
I
Services.
don't remember writing a like, providing testimony on this one. I think we just talked about it.
I think we, yeah, just made it.
Let me see, okay, so it was. 956. I'm not seeing it from last year.
Okay.
Okay, so SB 2104 relating to general excise tax, HHS, RAM. Oh, so this is the OTC one. So this is the one that's moving, the OTC drugs.
Sorry, which number? is it?
SB 2104.
So, and 1043 was the same? Yeah.
1042 is a carryover from last year, but I think it might be this one here. It's the SB 2104. And then SB 2106 prohibits the sale of OTC diet pills and dietary supplements for weight loss or muscle building to any person under 18. So not really us, you can check.
Okay.
SB 2283 relating to prescription drugs, repeal certain prohibitions on the imposition of fees, conditions, or requirements on community retail pharmacies that are not imposed on mail order. Wait, I just did that.
Yeah, that's probably the opinion.
Yeah, so same as,
Similar to, yeah.
which one was it? Oh, here, it's the HB 1539, so if you can just comment the same way that we want in person and we support intent of the go and in-person pharmacies. So yeah, that must be the companion. Okay, so SB 2610, emergency medications in schools. So that's the companion bill for, oh, this one has insulin.
Seizure meds, yeah.
Seizure meds, glucagon, insulin, oh,
So it's more administration.
yes, definitely not us, but
Yeah.
has medications in there, so we can just track it.
So
Okay.
going back to, sorry,
Yeah.
it was the, back to the, SB 956, I think it was SB 951 or HB 951 last year. And that was the one that you, Vice Chair noted concerns, of impacts on pharmacists. It doesn't state what those were, but, it does look like you guys did submit testimony. Or so maybe supporting the intent. So right now you have it as track.
No, I don't think we supported intent, did we?
What did we say?
Yeah, do you know what we said?
I think we're okay with it, other than the issue of corresponding liability with us with controlled substances. How would we know that it is not the primary care physician versus the,
Or that they're in the same practice?
yeah.
Sorry, I'm just trying to bring it up now. The
The
testimony.
script looks like a script, right? It doesn't say on here via telehealth only.
I think it's just, I mean, it just, if the guy's gone and the partner wants to give him a couple days, it allows them to, but um, I didn't know they couldn't do it before.
Actually, I guess I'm actually not seeing that testimony
Yeah. I don't-
submitted. Okay,
We have a lot of
Alright.
other stuff to write
I just
about.
want to confirm. Okay.
All right, so the next section, I don't know if we should take this out of order because the rest of it is exec session.
Another one
yeah.
of our bills isn't on here. I can just say it out loud so that we have it for the next minutes.
Is it related to one of these so I can bring it up or?
It's
It's just that the board can't make any questions or they can hear your testimony. That's it.
Oh, that's okay. Oh, I can just put it or say it out loud for the next meeting. It's our PBM bill, our reimbursement rate floor bill is House Bill 2225.
Is there any other bills on this agenda that are related to it or like it?
The most similar one is.
The one that we said didn't.
Yeah, the one related to MAC cost, we're advocating instead of, if I'm understanding that other bill correctly, NADAC plus the Medicaid dispensing fee as a reimbursement rate for.
So it's similar because that's why I thought it was yours, because it sounded like it. Which one was it?
Senate Bill 2047, the last one on your PBM list.
2047?
Yeah, number 7 under section A.
Oh, okay.
On page 4. I'm not very familiar with this bill, so I don't know how.
Oh, yeah, this is the one.
It's a
Okay.
reimbursement rate floor bill. Then there's also provisions about discrimination from affiliate versus non-affiliate pharmacies
In their bill or yours?
in my bill, in our bill.
Okay, so that's different. And
And it mandates a pass-through pricing model to eliminate spread pricing,
pass through what?
pass-through pricing model.
And Medicaid floor pricing. What is it? Medicaid floor?
Reimbursement rate floor for dispensed medications is NADAC plus the Medicaid dispensing fee.
And your bill is proposing changing the dispensing fee?
No.
Putting in a
The
dispensing.
reimbursement rate floor is the equation of the NADAC cost plus the Medicaid dispensing fee.
That cost plus dispensing fee.
It's much broader than this bill.
Yours is broader than this bill.
Yeah.
And it got referred somewhere? 2225 went somewhere?
It is, oh no, it hasn't been assigned yet. It was introduced and passed first reading yesterday.
Okay. So we can add that to the tracking list. I guess we can't comment on it.
No, but I can add it to the agenda for February.
And sorry, we're gonna hurry because she needs to leave, but can we take this out of order, the fees, because that's a public thing, and then go to applications after?
I mean, yeah, if you.
In case they have questions on the fees, no, okay. Because this is my agenda item, right, that I wanted to
Right.
discuss the fees. So is that okay with you guys if we move fees first? Before the
Fine.
applications, or do you guys want to go out of into exec session?
Okay. go with these.
Yeah, we can do it.
Okay, so can we talk about how the fees need to get changed?
Yeah, okay. So,
Process, Chris.
so it's kind of a difficult process, because it's not really in the board's hands per se, but professional vocational licensing have, they have, sorry. Sorry, administrative rules, sorry. 16-95, or sorry, 16-57, I believe it is. 53, sorry. Within this chapter establishes the fees for all of the licensing boards and programs. Broken down within each of those sections would be all of the fees for applications, the license fees, the renewal fees, restoration, the RICO compliance resolution funds. That all those fees are within there. So in order to change the fees across the board, you would need to basically make a request that these get amended in those chapters.
How does that differ from like Corey's bill that would increase fees by X amount? So hers is just
Well, it's
always
going
in
into
the
statute.
Okay.
So that would go into statute and supersede the rules.
So all of the boards, not just you, but all of the boards and commissions in PVL, their fees are in 1653. Pharmacy is 1653-33.
Okay.
On page 53-41. This is in your packet.
Yeah.
So if you want to look and see right now, application fee for pharmacist is 50, pharmacy is 100. Wholesale prescription drug distributor is 100. They don't have yet, they have pharmacy intern, but not pharmacy tech.
No.
So this is a rule, so it's got to go through the administration, that whole process to getting rules updated.
Right.
So that's
Farm tech. So it's not in here, you just.
We have to make a request to the director that is basically is the same equivalent process as one that's already established. And then we use that as the reference.
Right, so the dollar amount for farm tech. Farm tech is not currently in, but you've already.
Yeah, because
instituted it because you need to charge something.
yeah, we need the fees to process.
And so-
Those are standard fees, for example, like the application fee, for example.
So when you want to adjust the farm tech,
Yes,
you could likewise adjust the rest of 33.
correct.
Right. If I select the.
Yeah, we can work on that.
Okay.
I can work with you individually if we care.
Okay. Yeah, I think
Bring it to the board.
we need to address. When we do the tech, because we did say the tech is not cited, so bring the tech and then look at this.
All right.
So the non-negotiable part would be the RICO fee, that one we have to take, no, regardless, right? What else is all the add-on things?
Well, whenever you add farm tech to 33, you can adjust like 14 compliance resolution fund.
Oh, okay.
So if you want to bring that up and lower farm tech compliance resolution fee, you can do it there.
I guess my, with number 14, with the RICO fund, then, I would like to talk to RICO to see how many cases have you guys done? I don't see any packets. I mean, so why are we paying $74 every 2 years per person for a fund that, you know what I mean? If we're not, if they're investigating, you know, I don't know, elevators.
I don't think it's by number of cases.
It's more
not
just-
number of complaints. Otherwise, contractors would be through the.
I was gonna say, like, I feel like I'm funding.
But
Actually, based on this chapter, the fund that we pay the $100 was for pharmacists. We made the $100 for the technicians, but right here it specifically says pharmacists, but then on the line 14, it has everything else. But I guess it doesn't, since we don't have anything defined for the technicians, that's where the 7, that would have been less.
that's a
Actually,
20.
no, it's more. Never mind, it's more. My math's not good today. But we could establish something for the technicians or
We have to, right? Put commissions in
like
here.
or omit them, because like the pharmacist intern permit is only $10 and that's how much they pay, right, for the pharmacist interns.
Yeah, how are the interns exempt from the resolution fund?
I would have to look back at how it was established then.
Cause, and I think that's why Corey put like the $20 is that we didn't realize that they would be part of cause they're a permit too. Or their registration, they're not licensed or whatever, but they got tacked on the RICO fund, the RICO fee. And the interns don't, they pay $10. So these are questions I have, I don't know who to ask them to. Who? Who do we have to ask?
We have to ask PVL.
But, if we increase the pharmacy fee and decrease the tech, then, at least it's not like we're gonna decrease overall, we're just gonna shift fees.
Yeah, and I can, like I said, I can talk with you, Chair.
Yeah.
About.
Also the other state
present
fees,
this to the
cause,
board.
yeah.
Okay.
But honestly, it's really not. It's not apples to apples when you look at other states because they may be structured differently from PVL. PVL is an umbrella agency, whereas in California, they may just have a silo. Pharmacy has its
All the
own
costs and all the employees.
own RICO, its own investigators, its own attorneys.
Yeah.
So the umbrella, which might be more common in smaller states because they spread the costs out over all the different boards and professions, that might be the better comparison.
Okay.
And like I said, they don't go by number of cases prosecuted or complaints about a pharmacist. It's about how many are we licensing and the costs spread
Spread out over all registrants.
population.
Fair enough. I would just like to at least try. Before I leave, in June, by the way, June. We have to do this soon. Let me remind you,
If
June.
you make it similar to what the interns are, that'd be great.
For the techs, right?
Yeah.
Yeah, I guess that's the question too, is interns and put the techs with the interns and put them in the RICO fund.
Well,
Not
I mean,
put them
one thing,
in-
there's a lot more techs than interns. And there's probably more techs doing things they shouldn't do than interns. So, yeah.
The interns, we see them on the pharmacist registration.
Yeah,
We see all their
exactly.
things. We'll see them later, right? Okay, okay, for the rest of us, we're gonna go through applications. Next meeting is February 19th. I hear we have quorum, so anything else from the audience before we go to executive session? We're good? You guys good? Okay, so can I get a motion to move into executive session?
Motion
I
to
so
move into
moved.
session.
Oh, everybody's moving. 10:40.
So sorry, was that Alan? I think
That was
Alan
Alan.
started first.
Okay, Alan, second. Come on, Catalina, now it's your turn.
Okay, I'll second. I didn't
All
want
in
to go
favor,
sometime.
aye?
Aye.
Anyone opposed?
Aye.
Okay. Okay, so at 10:40, moving to executive session. Thank you for coming. Hello.
Okay.
Okay, we all back? Mark here, can hear us? Catalina, you can hear us? Alan?
Yes.
Yes.
Yeah,
All right, so we forgot to vote on all the bills that you're gonna be commenting on. Do you need us to just say all together like what we discussed on individual stuff?
Yeah, just you can say, make a motion to,
Authorize EO to write letters based on our discussion?
sorry, let me just say this quick. So your motion would be to approve the positions formed by the board during the meeting on bills 1 through 32. And we can instruct the EO has that authority delegation, I think, to
Submit
provide on their
testimony?
behalf. So it would just be that you guys are voting to approve the board's positions on bills.
Yeah, I
bill
move
number-
to approve the board's position on bills 1 through 32 on the agenda based on discussion we had during the meeting. And EO to.
second. Mark.
Second.
Second.
All in favor, aye?
Aye.
Application, so Joshua Close and Suzanne Otani and Noli Diaz.
I wanted to say I'm familiar with applicant number 2, but can consider and vote objectively on the application.
Okay. So for the first 3, so for Joshua Close, Suzanne Otani, Noli Diaz, can I get a motion?
Mark, I move to approve.
Sure, I second.
All in favor, aye?
Aye.
Aye. Okay, so unanimous on those 3. For Miguel Cortez. Okay, Chair moves to conditionally approve the tech registration with the following conditions. Current and future signed acknowledgement to the EO from current and future employers. Vaccination limited to patients 18 and older. And an annual letter of report from probation officer every year after approval of,
based on the effective date of the
okay,
license.
based on effective date of the license. Conditional approval as long as those 3 conditions are met. Okay, a second.
Do we need to put a end date on that? The 3rd condition?
Oh, yeah.
Whenever he finishes probation.
Probation complete.
So probation is completed.
Yeah.
Good. Yeah, otherwise you wouldn't have a probation officer.
Okay.
Okay. I need a second.
You were the motion?
I was the motion.
Okay.
Give me a second.
Second.
Catalina. All in favor, aye?
Aye.
Aye. Alan?
I said aye.
Okay, good. Sorry. Okay, so unanimous on the conditions for Miguel. LT Buyer, Pharmacy Buyer LLC. What did we say?
With the exclusion.
Approve, but conditional excluding Paydor from dispensing to Hawaii.
That's your motion?
Yes.
I second that. All in favor?
Aye.
Aye, okay. So that one's conditional. Next one is Clipper Distributing Company LLC. We're gonna defer, we need a pick. Because they listed that they are a out-of-state pharmacy, right? Yes. Okay. We don't need a vote on that, because we're deferring.
No, you do need to vote.
Oh, I make a motion to defer and request PIC. Can I get a second?
Second.
That was Mark. All in favor, aye?
Aye.
Aye, okay, unanimous. Next one is Vetoquinol USA distributor. Very good, this one?
This is the one with the license in Texas.
So we're good? That was what we talked about, the wholesale permit, right? We don't have a PIC. So motion to approve, miscellaneous permit. Can I get a second?
Second,
Who's that? Alan?
Alan, yeah.
Favor aye?
Aye.
Aye. Okay, good. Melbourne Pharma. I make a motion to approve, the miscellaneous permit as long as these 2 pages are not relevant to their application. So there's a paper for Brianna Morabito, and there's a sheet in here for, student Mary Wynn Tucker. So as long as these were inadvertently added to our packet, then I would move that this is. Second,
Kathleen, I'll second.
all in favor, aye?
You're gonna
Aye.
verify the pages, yeah.
Okay.
Aye.
Aye, okay.
Good.
All right, so, do we need anything else?
No.
Good. Okay, so next meeting, February 19th, downstairs in the normal room. If nothing else, we can adjourn the meeting, 11:57. And thank you guys for attending.
Thank you, Chair.
And I will see you in February and then these guys in March. In person, please, these guys. Pack it early, please.
Yep.
If it's gonna be this big.
Yeah.
And then, we don't need to do anything if you guys need testimony, like going forward, like if you want us to come, as long as if I testify for the board, as long as I stay in the